Hello and welcome. Today we're diving into a condition affecting the urinary system, the ureteral fistula. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. So, let's get started. Ureteral fistulas are generally acquired, meaning they develop due to an external cause rather than being present at birth. The most common culprit is surgery, particularly gynecological, colorectal, or urological procedures. Other causes include trauma, such as penetrating injuries to the abdomen or pelvis, inflammatory bowel disease like Crohn's disease, radiation therapy targeting the pelvic area, and, less frequently, advanced cancers that invade and erode the ureter. In rare instances, ureteral obstruction leading to increased pressure can contribute to fistula formation. The pathophysiology of a ureteral fistula involves an abnormal connection forming between the ureter and another organ or body surface. This connection allows urine to leak out of the ureter and into unintended areas. This can lead to inflammation, infection, and various complications depending on the location and size of the fistula. For instance, a ureterovaginal fistula allows urine to leak into the vagina, while a ureteroenteric fistula allows urine to leak into the bowel. The constant leakage can irritate surrounding tissues, compromise organ function, and create a pathway for bacteria to enter, increasing the risk of recurrent urinary tract infections and systemic illness. Accurate epidemiological data specifically for ureteral fistulas is somewhat limited, often being reported within broader categories of urinary fistulas. However, it is understood that ureteral fistulas are relatively uncommon. The incidence tends to be higher in regions where surgical expertise or access to advanced medical care is limited, especially in areas where obstructed labor may lead to pelvic trauma. As mentioned earlier, iatrogenic causes, primarily surgical procedures, are the leading factor in developed nations. The prevalence may also vary depending on the specific underlying cause, such as the prevalence of inflammatory bowel disease or certain types of cancer in a given population. The signs and symptoms of a ureteral fistula can vary depending on the fistula's location and the organs involved. Common symptoms include urinary leakage from an abnormal location, such as the vagina, rectum, or a surgical wound. This leakage can cause skin irritation, pain, and a foul odor. Patients may also experience recurrent urinary tract infections, fever, abdominal or flank pain, and hematuria, or blood in the urine. In cases involving the bowel, symptoms may include fecaluria, or stool in the urine, and pneumaturia, or air in the urine. The severity of symptoms can range from mild discomfort to severe debilitating pain and systemic illness. Diagnosing a ureteral fistula requires a thorough clinical evaluation and a combination of imaging techniques. Initial assessment often involves a physical examination and a detailed medical history, focusing on prior surgeries, trauma, or underlying medical conditions. A urinalysis may reveal signs of infection or blood. Imaging studies play a crucial role. A cystoscopy, which involves inserting a small camera into the bladder, can help visualize the ureteral orifices and identify any abnormal openings. A retrograde pyelogram, where contrast dye is injected into the ureter, can outline the urinary tract and reveal the location of the fistula. A CT urogram, which combines CT scanning with contrast dye, provides detailed images of the kidneys, ureters, and bladder. Finally, a dye test, such as a vaginal dye test using methylene blue, can help confirm the presence of a ureterovaginal fistula. Ureteral fistulas can be classified based on their location, specifically the organ or structure the ureter is abnormally connected to. Common types include ureterovaginal fistulas, where the ureter connects to the vagina, ureteroenteric fistulas, where the ureter connects to the bowel, ureterocutaneous fistulas, where the ureter connects to the skin, often through a surgical wound, and ureterouterine fistulas, where the ureter connects to the uterus. The specific type of fistula influences the symptoms experienced and the treatment approach required. The treatment of a ureteral fistula depends on the size, location, and cause of the fistula, as well as the patient's overall health. In some cases, small fistulas may heal spontaneously with conservative management, which includes bladder drainage with a catheter and antibiotic therapy to prevent or treat infection. However, most ureteral fistulas require surgical intervention. Surgical options include open surgery, laparoscopic surgery, and robotic-assisted surgery. The goal of surgery is to excise the fistula, repair the ureter, and close the abnormal connection. Depending on the extent of ureteral damage, a ureteral reimplantation, where the ureter is detached and reconnected to the bladder in a different location, or a ureteral stent may be necessary. In complex cases, a more extensive reconstruction, such as a bowel interposition, may be required. Less invasive endoscopic approaches are also becoming increasingly available for select patients, such as using fibrin glue or clips to seal the fistula. Preventing ureteral fistulas primarily focuses on meticulous surgical technique during pelvic and abdominal procedures. Surgeons should be aware of the anatomy of the ureters and take precautions to avoid injury during surgery. Thorough preoperative planning, including imaging studies to identify any anatomical variations, can help minimize the risk. In patients undergoing radiation therapy, careful planning and delivery of radiation can help reduce the risk of radiation-induced fistula formation. Prompt management of urinary obstruction and underlying inflammatory conditions can also help prevent ureteral fistulas from developing. The prognosis for patients with ureteral fistulas is generally good with appropriate treatment. Surgical repair is often successful in closing the fistula and restoring normal urinary function. However, complications can occur, including ureteral strictures, recurrent fistulas, and infection. The long-term outlook depends on the underlying cause of the fistula and the patient's overall health. Recent research focuses on improving surgical techniques, developing less invasive approaches, and identifying risk factors for fistula formation. Advances in imaging technology are also helping to improve the diagnosis and management of these challenging conditions. Thank you for joining us today as we explored the complexities of ureteral fistulas.